1. Introduction. Famotidine is a histamine H2 receptor antagonist, H2 blocker. It reduces the production of gastric acid in the stomach and is commonly used to treat acid-related disorders such as peptic ulcer disease and gastroesophageal reflux disease, GERD. Point 2. Drug class. Histamine H2 receptor antagonist, anti-ulcer drug, acid-suppressing agent. 3. Mechanism of action. Famotidine works by competitively blocking H2 receptors on gastric parietal cells. This action decreases basal and stimulated gastric acid secretion, reduces gastric volume and acidity, lowers pepsin concentration. Unlike proton pump inhibitors, famotidine does not block the proton pump directly. Point 4. Pharmacological effects. Decreases hydrochloric acid secretion, reduces nocturnal acid output, promotes healing of gastric and duodenal ulcers, relieves symptoms of heartburn and acid reflux. 5. Indications / uses. Famotidine is used in the treatment of peptic ulcer disease, gastric and duodenal ulcers, gastroesophageal reflux disease, GERD, Zollinger, Ellison syndrome, heartburn and acid indigestion, stress ulcer prophylaxis in hospitalized patients. 6. Dosage: general, adults, peptic ulcer, 20 to 40 mg once daily, usually at bedtime, GERD, 20 mg twice daily, Zollinger, Ellison syndrome, higher doses as required, children, dose adjusted according to body weight and age, dose adjustment is required in renal impairment. 7. Pharmacokinetics: absorption, well absorbed orally, onset of action, within 1 hour, duration, 10 to 12 hours, metabolism, minimal hepatic metabolism, excretion, mainly via kidneys. 8. Side effects: common side effects include headache, dizziness, constipation or diarrhea. Rare side effects: confusion, especially in elderly or renal patients, bradycardia. For use, hypersensitivity reactions. Famotidine causes fewer CNS and endocrine side effects compared to cimetidine. Point 9. Drug interactions: reduced absorption of drugs requiring acidic pH, e.g., ketoconazole, minimal interaction with cytochrome P450 enzymes. 10. Contraindications and precautions: hypersensitivity to famotidine or other H2 blocker. SUSA with caution in renal impairment. Long-term use may mask symptoms of gastric malignancy. 11. Advantages of famotidine: longer duration of action, better safety profile than cimetidine, minimal drug interactions, suitable for long-term use. 12. Comparison with other H2 blockers: drug potency, drug interactions, cimetidine low, high, ranitidine moderate, famotidine high, minimal. 13. Clinical notes: famotidine is preferred in patients taking multiple medications, often used when PPIs are not suitable or contraindicated, available as oral tablets, suspension, and injection.